Pretty much everyone agrees that we're facing a growing youth mental health crisis. But here's the thing. How we solve it? Well, that depends entirely on how we define the problem in the first place. So today, we're going to unpack two totally different stories about this crisis and see how the story we choose to tell really shapes the future we're trying to build.
And look, this is not some abstract debate. Let's just put a number on it. A 2021 report found that about 1 in 6 children in the UK are affected by mental health issues. That's, what, like several kids in every single classroom? The scale of this is just staggering, and it absolutely demands action.
So, back in 2017, the UK government released a major policy plan to do something about this. It was something called a green paper, which is basically a proposal to get a public conversation started. It sounded ambitious, but the big question we're asking in this explainer is, did the plan actually diagnose the illness it was trying to cure? All right, so let's dive into the first story, the official one. This is how the government, in its green paper, framed the crisis and laid out its big plan to fix it.
The goal they stated was, powerful and positive. It was all about early intervention, getting kids the right help in the right place, right when they need it most. And, on the surface, who's going to argue with that?
Okay, so this is the crucial part, how the government actually defined the problem. They didn't see it as a fundamental lack of services. Nope. Their diagnosis was that the whole system was just inefficient. They talked about a lack of joined-up working between schools and the National Health Service. And this, they argued, was leading to a flood of the wrong kinds of referrals, which was clogging up specialist services for the kids who really needed them. It was framed as a logistical challenge, like a plumbing problem. And if you have a logistical problem, you need a logistical solution, right? So the government's plan had three main parts. First, put a designated senior mental health lead in every school. Simple enough. Second, create brand new mental health support teams to act as a kind of bridge between the schools and the NHS. And third, try to pilot a much faster 4-week waiting time for those specialist services. It's a very clear, structured plan designed to streamline the whole system. But that was only one story, because researchers, advocates, and a lot of the people on the front lines, they saw a completely different picture. So now, let's explore their counter-narrative. They started asking a really fundamental question. What if the issue wasn't just about messy referrals or a lack of coordination in schools? What if the roots of this crisis were way outside the school gates? What if the problem was actually much, much bigger? And this brings us to this key idea, the social determinants of health. It's the concept that our health isn't just about our genes or the choices we make. It's deeply shaped by the conditions we live in, our income, our housing, our communities. In fact, the source material for this explainer points out that children in the poorest UK households are about 3 times more likely to experience mental health problems. 3 times. And this slide really lays the two stories side by side. And wow, the contrast is stark. The government saw a process problem focused on schools and the NHS. But the stakeholders? They saw a societal problem, one rooted in poverty and inequality. It's like one side wanted to fix the system's plumbing, while the other wanted to fix the very foundations of the house. And in all of the responses to the government's plan from these stakeholders, there was this one giant factor they felt was being completely ignored, a huge political and economic context that was shaping this entire crisis, the real elephant in the room. And that elephant in the room was austerity. Stakeholders argued again and again that a decade of cuts to basically everything, from local councils and social services to school budgets and even the specialist mental health services themselves, was a primary driver of the crisis. Their point was, you can't solve a problem without acknowledging the policies that helped create it in the first place. So what happened when this counter-narrative was officially presented to the government? Well, the policymaking process has a formal consultation phase. It's a chance for experts and the public to give their feedback. And this is exactly where the two stories collided head-on. And the conclusion of the research paper this whole explainer is based on is, well, it's pretty blunt. Stakeholders raised these exact points about the narrow framing, about austerity, about poverty, but their feedback was, and I'm quoting the researchers here, largely ignored. This meant some really key criticisms just went unaddressed. The plan put even more pressure on teachers who were already totally overworked. It didn't have a clear strategy for vulnerable kids outside of mainstream schools. And this is a big one, many experts pointed out a huge flaw in the logic. If you give more support in schools, you're probably going to identify more children in need, which would actually increase referrals to specialist services, not reduce them. On top of that, critics pointed to the slow pace of the rollout. the government used what they called a trailblazer approach, just implementing the plan in a few areas at first. But the result was that even after 5 years, the plan was on track to cover only about a quarter of the country's children. That leaves a staggering 75% without this new support. For a lot of people, that just wasn't ambitious enough for a national crisis. So, okay, let's zoom out from this specific policy for a minute and get to the big takeaway. Why does this clash of stories matter so much? It really is all about the power of how we frame a problem. What can we really learn from all this? Because it's about way more than just a disagreement over some policy details. The academic term for this is problem representation. It's this idea that a problem doesn't just exist out there in the world, waiting to be found. It is actively created and framed by the language we use, by the policies we write. And here's the kicker. The way you frame that problem powerfully shapes and justifies the solution you come up with. So here's the bottom line. By representing the youth mental health crisis as a logistical problem of joined-up working, the government justified a logistical solution. But in doing that, that specific framing actively pushed all those deeper social and economic causes, that whole other story about poverty, austerity, and inequality that stakeholders were telling, it pushed all of that to the margins.
And that leaves us with a final thought. This isn't just about mental health policy in the UK. This concept applies absolutely everywhere. So, the next time you hear about a major societal challenge, ask yourself, what is the story being told here? How is this problem being framed? Because if we can change the frame, we might just change the entire world of possible solutions.